So healthcare issues are a perennial issue at the legislature, both on the commercial insurance side, which is where most employers buy insurance for their employees, but also on the public program side, which is a big driver in the state's budget and the reason why we watch it pretty closely. Well, healthcare costs are an important issue for employers. In this year's annual Business Barometer survey, business owners and managers ranked improving access to affordable healthcare options as one of the most important things that the legislature should address. So one of the ways that we're trying to do that is to improve healthcare options for particularly small employers. In Minnesota, we have a couple of significant barriers in place preventing particularly small employers from self-insuring. And if they're able to self-insure, not only would they have better control over the healthcare costs, but they would be able to avoid some of the health insurance mandates that you find in the fully insured market, but also some of the healthcare taxes. So while this may not be the silver bullet for everybody out there, we think that giving more employers more options when it comes to providing health insurance for their employees is something that can really help. So that's something we're going to be working on this session. The other thing on the public program side, there's been a lot of discussion about what to do with a couple of Minnesota's public health care programs, particularly MNsure and Minnesota Care, which offers public health care programs to the working poor in Minnesota. And while we don't necessarily expect a lot of debate and work on those two issues, that's something we're going to be watching very closely because, again, the decisions made about those programs have a significant impact on the state's budget, and we want to make sure that we're providing public programs to people not just in a way that makes sense and is affordable and financially viable for the state over the long term, but also in a way that makes sure that people have the incentive not to just stay in public programs forever, but gives them the incentives and the tools to move up the economic ladder and take that managerial position or take that new job with a little bit higher salary. Well, again, these issues are always kind of perennial issues at the Capitol. There's a lot of discussion last session when it comes to healthcare issues because it was a budget year. So there'll probably be less this year than there was last year. But the issue of providing those small employers with greater access to self-insuring is something that we think is ripe for action. We had a lot of success last session moving that through the House. It stalled out a little bit in the Senate, but that's something we're going to be picking back up and pushing on to hopefully get that done this session. On the public program side, again, because it's not a budget year, there'll be less action on that. But there has been a lot of debate and discussion about particularly MNsure and Minnesota Care, those two public programs. And so while most of that will be teed up for next session, that's a conversation we're going to be watching very closely and going to be engaging in as well. First and foremost, and most importantly, employers can contact their legislators. Every business in Minnesota is represented by at least two legislators, their House member and their senator. And if they have operations around the state, they're likely represented by even more. So contact your legislators, make sure they understand how important the issue of healthcare is to you and your employees and the underlying cost drivers involved with that. But you can also write letters to the editor. You can write op-eds to make sure that folks in your community know what you're doing to provide health insurance for your employees, but also the challenges that come with that. You can attend Session Priorities, which is the Chamber's big session kickoff event, the first day of session. That allows you the opportunity to network and meet with not just your legislators, but a number of other legislators and legislative leaders as well and communicate directly to them, again, about the importance of these questions of healthcare costs and the issues of providing health insurance to your employees. And then finally, just keep an eye out for updates from us at the Chamber as the session goes on. We'll be looking for your input and your engagement as the session goes on at strategic times to help make sure that we're able to move the needle at the Capitol in the direction of policies that will make it easier for employers to provide the insurance that they want to provide to their employees.